Welcome to today's episode of Kids Town Corner. Today we're going to talk about a really important topic to meet our common goal between dentists and our team here at Kids Town, or any dentist for that matter, and mom and dad with their kids. That common goal of having the best appointment possible.
Right, and when it comes to providing the best possible appointment for your child, not every child's the same, and so some things might work better for some children and not work as well for other children. And so what we try to do here at Kids Town is, over the 10 years that Dr. Brett and I have been practicing pediatric dentistry, we've seen some patterns where certain things seem to lead us to a more successful appointment more often than others. Now again, there are no rules when it comes to these patterns that we've seen. Just because something works for a majority of the children doesn't mean that it's going to work best for every child. But over the years, one of the things that we've seen affect whether or not a dental appointment with the child turns out successful or not, or goes well or not, is whether or not the parent is in the room with the child during the appointment.
Absolutely. There is some significant child psychology that goes into children behavior, and a big one is kids understand, whether it's mom or dad, they understand how to get what they want. And most of the time, they don't want to be getting their tooth fixed. They don't want to be in the dental chair. They don't want to need to get numb. It's not nearly as fun as being home, playing on the phone, or watching TV, or playing outside with their friends. That's what they want. And so kids can sometimes manipulate things to get what they want. And my kids are a perfect example of it. I see it every day. But when it comes to the dental practice, what we have found that in general, a lot of kids will step it up as far as being brave and being super strong, and actually just, not even really paying attention to things and kind of zoning out when mom or dad isn't there. A lot of times what it does is it lets them focus on the spiel that Ren and I have developed, or any of our dentists have developed, where really, first and foremost, yes, we are pediatric dentists. A close second is like child psychologists and profilers. we can pick up on children's behavior really quick on which direction we need to take this appointment. Is the kid like totally zoned out watching the TV to where, he doesn't need to hear much song and dance from me. He just wants my head out of the way so he can see the TV. He doesn't really care what's going on. Okay, that's gonna be pretty easy. But there are others that are slower to warm, or we're really just kind of we're working very hard to try and make this appointment as smooth as possible. If their focus isn't on what Ren and I are doing, but on either what mom's saying or asking about, and or just knowing mom's there, and the focus is on, okay, what can I do to get out of this, then we might not even get a chance.
Yeah, I've had situations where I've been giving the patient the injection, and I've been able to do it in a way that the patient didn't know that I was giving him an injection. I kept the needle out of his view of sight. I distracted him by wiggling his cheek. I put numbing jelly on the soft tissue before I even started my injection. I'm injecting the local anesthetic slowly to make it as comfortable as possible. And so the child didn't even realize I was giving an injection. And I think the mom was trying to be helpful, and she said, "Oh, is that the shot?" And all of a sudden, the kid just went crazy, freaking out, grabbing things, pulling things off. So it's just an example of how, like Dr. Brett said, we have our spiel that we go through. We have things that we do to try and make the appointment as comfortable as possible. And sometimes without meaning to, sometimes the parents being there, even though they're trying to be helpful, sometimes it can disrupt that flow. But again, it doesn't always work that way. What we found best at Kids Town is let's try that way first without the parent being there, because that's the way that we found for most kids tends to be the most successful. If we bring your child back and it's not going well and we're not able to get the work done, and then we'll take the second approach, which is, okay, we tried it without the parent first, now let's bring the parent back, now let's try it with the parent, and let's see if it goes better with the parent back here.
Yeah.
Sometimes it does.
Yeah, there's definitely some times where, you know, you're trying to figure out what's going to work best for this kiddo, and they're just asking for their mom. And if they're just asking for their mom, I mean, I'm not going to say, no, you can't see your mom. That's not going to work out well. That's going to make things way worse. So we'll say, okay, yeah, let's get mom, and we'll call for mom, and they'll come back, and maybe holding mom's hand, that's what helps them be braver, and that's going to get them through, and mom understands that. Maybe we have a little conversation before, yeah, kind of having a struggle, you know. I'll still try and do my thing, but if you can hold their hand and just kind of hang out, let's try it out. And some kids do perfect with that. And so all these things aren't hard and fast rules as far as coming back and bringing your kiddos back. There is one that we have a very strong suggestion, and that is with sedation. So when it comes to needing to sedate your child, whether we're doing an oral sedation where they drink the little drink, or they're getting an IV sedation with one of our sedation specialists that's here, then that is more of a hard and fast rule to where we get the kiddo back on their own. We're really, with an oral sedation, Dr. Wren and I are wearing two hats where we are focusing both on getting the work done and doing a good job, your child's behavior, and we're monitoring and making sure they're doing well with the sedation. So all of our attention needs to be on your child and the safety of your child and how things are going. Not, you know, answering questions of, is this all normal? Is this and that going on with the sedation normal? We need to be focused on your child and make sure we get a great job. Now, at the same time, when it comes down to that, you can totally pop in.
Yeah,
you know,
absolutely. Anytime during the appointment, the parents, they can grab an assistant and say, hey, I'd just like to peek in on my child and see how things are going. The assistant will walk you back, let you peek in, let you see how the appointment's going. Be careful not to let your child hear you, because sometimes the appointment's going great, and as soon as they hear mom's voice, they're like,
they want to go that way.
Mom, save me, but the appointment might be ended early that way. But if you kind of peek in, your child doesn't see you, you give me the thumbs up, I give you the thumbs up, you can watch for a second, see how things are going. That's perfectly fine. We encourage it. You're always welcome to do that, even with the sedations, no matter what type of sedation it is, with the conscious sedation or with the IV sedations with a nurse anesthetist. So just know you can always come back and peek in. The idea with in a situation like that isn't for you not to be able to see your child. The idea is for your child not to be able to see you.
Yeah, that's a real good way of putting it. Yeah. And when it comes down to it, I mean, honestly, we've got the same goal. Yeah. We want your kid to have the best experience possible. We're going to treat them as if they were our own. We're going to do everything we can in our power and our training to make it a great appointment to where your child, regardless of what type of work they're getting done, how much they're getting done, what type of sedation they're receiving, if any, that they're excited to come back. Or at least they can tolerate coming back, that they don't have a lifetime of fear at the dentist. These kids need to grow up and be adults that can go to the dentist without their mom. You know, right? At some point, they've got to be able to get that separation, be able to go back. And so if they learn that at an early age, and when they come in, you know, they come in and mom comes in, she can grab a magazine, you know, her son or daughter can go back to the back, give mom a 5, I got this, mom, go back, get his teeth fixed, come out, give 5s, get prizes. That's how it usually goes.
Yeah. And that's our goal. That's our goal, to get there with all of our patients. And getting there, the best way to get there is what we can work with the parents, together with the parents, to figure out. And our goal, we want all these appointments to be successful as possible. We understand that for a lot of parents, bringing their kids in for a dental appointment, it's time off work. It's time out of school. It's arranging for babysitters and all these other arrangements for all the other siblings. And so our goal is to try and make every appointment as successful as possible. And these are just some of the things that we've learned over the last 10 years that have helped us be able to make most of our appointments successful.
So we hope by you, some of you have already heard the story from us, some of you hear the story from our staff members, but we hope that most of our Kidstown family out there can hear this from Ren and I, the reasoning behind it, why we recommend it, so that when one of our awesome team members, comes out and says, hey, we're going to go ahead and get Timmy or Susie back, well, let's go ahead and bring them back, let's see how they do, you'll understand where we're coming from, what we're trying to do, and that it's not just this, oh, wait a minute, what's going on here? We want that to be as smooth as possible, and then, like I said, we are a team here. We want to work together with you to make this the best experience possible here at Kidstown Pediatric Dentistry. So that's today's episode of Kidstown Corner. We'd love for you to share this. We'd love for as many of the families that are here in our practice to see this video. So please make sure your friends and family see that so that they know. And if they're at a different dentist, trust me, they've seen the same things. This isn't just here in our little neck of the woods in Utah. I mean, nationally, internationally, worldwide, this is the same idea that we can have, in general, a much smoother visit by getting your child back on their own and letting them get their confidence up and be ready to do this on their own anytime through their lifetime. So, thanks for watching. Any questions, comments below, please let us know and share with your friends. Thanks.